Dear colleague, thank you very much for inviting me to present WHO's work towards developing a global urban health research agenda, and happy World Cities Day to all. Before speaking about WHO's research agenda, please allow me to start with some key figures just to set the scene. We know that 55% of the world's population lives in cities and that this percentage is going to increase. We know that this is particularly relevant in low and middle income countries, and in particular in slums and informal settlements. And there is evidence that the top 10 causes of death are actually related to urban design, planning, and urban policies. And the slide shows obviously a large number of the key risk factors that urban dwellers are facing nowadays. So these figures call for urgent action to act locally for global health, not only because urbanization is a key challenge, but also because actually taking action at the city level constitute a key opportunity for targeted action, because cities do react quickly and innovatively, because they are actually the primary implementers of sectoral policies, but also because acting at the very city level is a key way for addressing health inequalities. And finally, because we have solid evidence of what works in cities. WHO has been working on urban health for many years, decades, and there is actually an increased recognition of the importance of urbanization as a determinant for health in the current programmatic work of the organization. And for many of you who know, WHO has 6 core functions, and one out of them is actually to shape the research agenda and to stimulate the generation, translation, and dissemination of valuable knowledge. So on this basis, back in 2020, a strong call was made to WHO to provide support by developing an urban health research agenda, and with the objective really of a medium and long-term impact at the global scale, at the national scale, but certainly most importantly at the very local level. So WHO has started developing the urban health research agenda with 3 main objectives: to identify the gaps in urban health research, to develop global research priorities, and thirdly, to provide solid evidence for the development of context-specific multi-sectoral interventions that do promote urban health. The methodology that was developed encompasses several steps, and the first one, and probably the most important one, was to implement a global scoping review of the published literature. And this piece of work has been commissioned by WHO to the International Society for Urban Health. The International Society has also performed a large analysis of big data, examining and identifying the connections between urban health concepts and actors globally, and more than 100 in-depth interviews were implemented with urban health researchers and leaders in the 6 WHO regions and related languages. WHO has complemented these pieces of work by doing an in-house mapping of the urban health activities, but has also developed and disseminated a survey aimed at understanding the needs of implementers, of decision makers, and of the civil society in cities around the world. In developing the research priorities, 6 principles have actually guided the identification of the priority areas, and namely the need for adopting a systems approach, but also the need for co-production of knowledge. Equity has clearly been identified as a transversal element. Cost benefit and cost effectiveness considerations have been identified as key. Sustainability, and finally environmental impact. So the research itself has to be environmental friendly and sustainable. So 4 main categories for urban health research have been identified that you can see on this slide: the need for strengthened link between urban health research finding and actions, the need for building city-level evidence on the relationship between environment, economic, and social factors, but also the need to generate evidence in under-researched thematic areas, but also on under-researched urban population subgroups. Among all these, there are clearly a large number of priorities that are related to health systems research, such as strengthening the links between urban health research findings, the need for looking at norms, regulations, financing and reporting, performance mechanisms, and the incentives to improve equity in service provision, but also importantly to access to health services and the methods for engaging local health systems. So having better understanding of these systems have been identified as a clear priority. So these priorities actually are going to be available today. We are launching the research agenda today, and we do hope that it will be used and translated also at the regional level to identify some of the priority areas necessary in the different contexts. And with this, I would like to thank you for your attention and wishing you a good rest of the meeting. I would like to come to an end and thank you very much for your attention, and I hope that these priorities will be picked up and that they will also be translated into regional research plans that will further identify specific needs of regional work. Thank you very much.